Hi everybody, I've been asked to help Beacon Transport team know what to do when they have a maternal transport. So first and foremost, you meet us in the ambulance bays or just inside the ER normally to pick us up. So when you do meet us, if you could let the nurse know your name, your role, and your risk assessment score for the day. That would be wonderful because she's going to need to plug that information in her chart for the computer. Whoever's driving, we need to know the weather and road conditions as part of that risk assessment as well. So have that ready. The last thing is we do have the Zip It app on the maternal phone for transport. However, if it's not functioning, which it hasn't been yet, please provide your phone so the nurse can get a patient report off of it and any information like sending physician and anything else. Perhaps let them take their phone and do a screenshot of your phone. And then normally we are toting along 2 big bags. So when you meet us, perhaps you can grab one so the nurse only is pulling the other one. Ultimately, the 2 bags need to be secured in the back of the ambulance, whether that be in the chairs and you seatbelt and strap them in place, or one in a chair and one onto the cot. That's patient dependent. And knowing the information of the patient and why you're going there will help determine what you need to take into the hospital. If it's a patient that's going to need monitoring because it's a facility that probably doesn't have a fetal monitor, then the monitor would need to go in with you. If not, then the monitor can actually be mounted in the back of the ambulance. So where you normally have the single seat with the Zoll and possibly the vent, behind your Zoll monitor, in the back part of the ambulance, there's a metal bar. This is just like all of our equipment on MedFlight. And so these latches are designed to actually mount right into that metal bar. So first of all, they need to be unlatched, and there's a beveled side on this side. So when mounting them, you need to take and angle it, which is kind of hard with this plate, but you need to angle it on the bar before seating it and then latching it into place. But the nurse may need assistance with that. When it's put in place, there's a plug that comes with it that needs to go to your electric, so it's actually into a plug. And then the patient, when they come back and are placed on the monitor can actually be plugged into the device. But the power button is going to be right in front of that, and the maternal nurse should know that. Also, depending on the patient condition, will dictate if the Zoll cardiac monitor needs to go in with the patient or not, which again, you can have the nurse decide and let you know. If the monitor does need to go in with the patient, then take it as planned with your normal patients. If not, you can leave the Zoll there, and please assist the nurse in hooking them up to your transport monitor. It would be important for you to ask the nurse how often blood pressures need to be checked. If you have a patient who's hypertensive or preeclamptic, their blood pressures may need to be checked more frequently than someone who's perhaps in preterm labor. So depending on the patient's diagnosis and condition depends on how often the blood pressure parameters need to be checked. And you being an extra set of eyes and part of the team would be a great asset in watching that monitor and making sure there's no abnormalities that need addressed with the patient. Again, perhaps at bedside, or maybe waiting until the patient is loaded. And then, of course, the last thing is making sure the blue consent sheet is signed. An extra set of hands, an extra set of eyes, just making sure that we have that blue consent sheet signed by the patient before we leave the bedside, and then just follow the cue of the nurses. Whatever they need done during the transport, help them out with. And at the end of the transport, once the patient has reached the destination, the nurse needs to know what the loaded mileage is, because if they don't get a Zip It with the information, please let them know the loaded mileage. And please print off a trend summary so they have all the vitals, and also please upload the vitals. While the patient's on the cardiac monitor, remember to hit a snapshot so the cardiac rhythm goes into the cloud and they can put it in their chart. And anything else, just ask the nurse, and good luck. Thanks.